I have very bad difficulty breathing for a month now, and very, very severe back pain. My left side to my knee, and my right side radiating from my neck to my shoulders. And difficulty walking long, standing, sitting, and abdominal pain I have.
Okay. How long?
Headaches.
Oh, headaches. Okay. So how long can you walk before you have to take a break?
Walking usually maybe 30 minutes to an hour.
Okay, that's not too bad. What about sitting? How long can you sit?
10-15 minutes. I would have to adjust my movements or get up.
So why do you feel what? What kind of discomfort do you feel?
Like a really bad pain on my left side, on my and my neck. I can't like move it, or it's restricting me.
Understood. Understood. And let's go to the headaches. How often do you experience those?
Frequently. Could be once or twice a week, but recently it's been like almost every day. And I had really severe pain on my left side mainly, and it goes down to my shoulders.
Can you trace that on the left side? Where do you feel that?
Right here, and then down.
Okay. Sounds like a trapezius referral pattern. All right. So next component, let's go to the chest. You said about difficulty breathing past month. Okay. So what does that feel like?
I can't inhale completely. Like it's restricting me.
Do you feel any chest tightness or what?
Chest pain, like sharp pain sometimes.
Usually where, on the right side or left side?
It's mostly on the right side. Some sharp pains.
Okay. Anything else?
I think that's about it. Yeah. Oh, heart. I have a heart arrhythmia.
Heart arrhythmia. Understood.
Yeah.
Okay. And that's from your medical doctor diagnosed that, and is that a congenital issue or is that a more recent problem?
It's a premature or Yeah.
All right, so that's something I can't, can't just with that. You're born with that one.
Yeah.
All right. So what about? I believe we went over the history. I believe heartburn. Right?
Yeah.
How long has that been going on?
Since my teens. So for a while, but it gets worse, like over time. It's been getting worse too.
So it's getting progressively worse.
Yeah.
Okay. So, when did it start getting progressively worse?
Past year now. Yeah.
So for the past 10 months. All right. So what we're doing right now is we're using this instrument right here to look for signs of inflammation. Right? So when a tissue gets damaged, such as a disc or a ligament, muscle, tendon, so on and so forth, your body gives off a signal system, which is inflammation, which tells the body, go fix this right here at this particular region. Several signs of inflammation is tissue swelling, all right? And that's what we look for in visualization. But another component is heat. So this device, we're looking for any abnormal heat in the area. And we're finding another one right here. But I do see some kind of chronic swelling here, so let's tilt this. There it is. Right at that level. That's what I figured. So we have a lot of heat noise in here. Can you look up straight? Okay. So now let's see what this does for you. And there it is. So when you're in a proper neutral position, okay, what it does is, because when you put the head downwards, what it does is it opens up the gap a little bit. Okay, it takes some pressure off the nerves. That's a little hard to find. But when we put you in a regular neutral position and we scan your neck, then we start to see the little nerve pressure at the very top. It's very subtle. See, it's just that one point all to the right. Things to keep in mind, because she's very petite, upon visualization, what I already see is there's a huge pool of swelling over here. And some on the right hand side over here as well. Let's have you stand up. See, it's even more evident here. All the swelling pulling over here. And we see there's also some pulling over here as well. It looks like it came from here and it just sunk down over here. This region as such. Have a sit down, please. Alright, so we're going to take a look, see what's going on in this region over here. Tender right there?
Mm-hmm.
Alright. What about this fellow here?
Not so much.
Not so much.
Yeah, it looks like
So is it tender on the bottom part,
mm-hmm.
the side, or the top part? Right here?
Yeah, right there.
Yeah, bottom part. Alright. Tender right there?
Mm-hmm. Yes.
Yeah, it's right there.
Mm-hmm.
Tender right
Yes.
there? Okay. And tender right here too, huh?
Yes.
Yeah. And it looks like you got some chronic swelling over here as well, so yeah. How's that feel right there?
It hurts.
Mm-hmm. Okay, sit back please. Sit all the way back. Now, there's a lot of muscle tension I feel over here. All on the right side. Not too much on the left side, but definitely on the right side. Quite a bit of swelling here as well. And with petite, skinny patients such as yourself, that's why we get to probe and examine very carefully and very deeply to find all these tissue swellings, because it's very subtle, it's not much. Tender right here?
Yes.
Yeah, that's right at that atlas. How about this fellow right there?
A little bit.
A little bit more so on this right side here, huh?
Yeah.
Yeah, certainly is. All right, let's check that fellow. Alright,
Mm-hmm.
for that little one, yep, it's itching to go. So we got that atlas. We're to get that fellow a little more deeper to go. Alright, let's take a look over here. Alright, so here's a story with your situation over here. So we're talking about, okay, you got the headaches. You know, you also talked about pain going down both sides, you know, left side, right side, all straight down to the knees. Okay, so whenever I hear a case like that, where we're talking the whole entire body's involved,
Mm-hmm.
it's usually what we call the upper cervical region. That means the very top part over here. Now we tested, confirmed on you. Yes, the atlas, there was a problem there, and even did a little premature partial correction right off the bat. Because the body is so intuitive, it knows what the slingshot back, because when it's wound up like this,
Mm-hmm.
okay, and if you find a little means just to take some of that twist out of there, the body will try to slingshot right back in the proper place. So we got part of it already in there, but we got to get a lot more deeper in there when it's called for. Okay,
Mm-hmm.
so we're going to correct where the true problem started first, and then we're going to take another closer look at the atlas, see if it needs to be corrected after all the other corrections. So now, this is what the old standard problem is. So you're talking about, okay, so we covered the whole entire body, upper cervical, right? Also can explain the headaches,
Mm-hmm.
right? Can also explain the TMJ issue, which you have right over here. Okay, it's deviating over to the left,
Mm-hmm.
all right? And also, let's see what else. Now, in terms of sitting too much, and why is it aggravating a bit? We tested, confirmed, and that's what I see over here. Okay? This signal over here is originally supposed to come in 5 pieces when we're born.
Mm-hmm.
It's the last bone that turns into one bone. Right? And it fuses there around 27 to 32 years old. So you're not there yet. Right? That's why we start to see these during the process of fusing. But this one is more swollen and bigger than the other ones. That only happens if you had some kind of trauma to it that knocked that out of alignment.
Mm-hmm.
So this is what we need to address. Right? Another thing we tested confirmed on you, that we need to address as well is this fourth lumbar. All right. And the next component is going to be the sixth dorsal over here, because it should have a nice progression. Right. This number 6 over here is leaning a little bit backwards. As in other words, it should follow along like this. This is normal for your mid back, but on you, okay, it went a little bit backwards like this. So because that little kink you got going on there, that's what we see in this kink over here as well. In addition to what happened to everything else is because since this foundation went out and that fourth lumbar also went out, that's what you saw that spine became unstable. To the left, to the right, left, and then right. Doing all that zigzagging. So basically you got the leaning tower piece in your spine, right? So we have to stabilize this. Once we address this, everything else is going to take all that tension out. In essence, your spine did that. So we're going to start taking all that tension off like this, right? Relieve the pressure over to the upper cervical region as well, right? And then we're going to cover the next part. This is another thing to help explain why you're experiencing heartburn and then digestion and so on and so forth. I'm seeing this. This is what we call a magenblase, right? This is a lot of gas bubble here that only happens if the lower sphincter to your stomach. We have 2 sphincters. If you want to think of it like a gate. The top part of the gate, whenever that opens up, everyone knows what that is. That's what we call heartburn. All that acid comes right straight back up to our throat. Right? Therefore, this top sphincter is not closing right. That's how you get heartburn. Now, if the bottom one is wide open as well, what happens is that when all the bottom gases go straight up into the stomach, that's all that belly gas. And you can see all these gases here, right? Somewhat from the intestines. But the other small intestines, they're fine. I see this, it's clear. The large intestines, see all this over here, that gases? You got constipation over here. This is what we're seeing over here, right? That tells us that this nerve and this nerve, either one or the other, most likely this fourth one over here, is not working as well as it should. Therefore, the colon is not working as well as it should either. So, next question is, do you experience constipation?
Time to time, yeah.
Time to time. So that would explain it right there. So we gotta free up, get the pressure off the nerve, get these colon to work again. Here's the other component as well. No, for most patients, I would correct just this. But because this bone over here, your fourth lumbar, is quite inferiorwards, I need to correct this as well. The reason being is that your spine, because it's so vertical, the same foundation, in essence, you're doing this. Right? So what your body did to compensate was it went like this. But that fourth lumbar also still went way backwards. So even though when we correct that sacrum, push it forward, it's going to further exacerbate that fourth lumbar, make it tilt even more backwards as well. So you won't like that, and it's going to make, it's going to exacerbate that constipation as well. So we're going to correct both of these right now. Right? So we're going to push this thing. All right. And we push it. All right. Come up. Open up.
I relieve pain a little here.
All right.
On my left side.
Anything else?
Less, like, muscle, how do you say it?
Tightness?
Tightness, yeah. Sorry. Forgot that.
Let's see over here. I'll check that fourth lumbar of yours. And the inferiority is still there. And you feel that now?
Yeah.
More tender now, yes? See, so after we correct your foundation, it made this even more inferior. So that's what we're talking about there. We do need to correct this after all. That's wrong. Right there. Come on up. Walk around. stress or your tightness on your shoulders or your neck?
A little bit, like I can breathe a little bit.
Good.
Like not, something sitting on my chest, basically.
Good.
But yeah, it
Anything
feels
else?
a lot better here.
Good. Next part. Here's a hidden sixth cervical problem. Okay. I usually have to see it. That's the other thing I see in the X-ray as well. There is an ESRA atlas. The problem is this. When we fix that sixth dorsal the way it is, over here, right now, this bone over here is this way. Okay, that's causing a lot of your chest discomfort and heartburn as well. But once I correct this, it's going to make that worse. So there's got to be a hidden problem, and it looks like that's sixth cervical. That's what I'm going to double check on you. Now bear in mind another thing as well, because you're very petite, okay, a lot of things, a lot more harder to find. And that's why it's also very imperative. No, there is, it's right here. That is very subtle. There it is. You feel that right there?
Yeah.
A little bit stuck there, right? So that's sixth cervical. We do need to address that. We'll address that after we correct your sixth dorsal. Okay, right this way. No more. Just like this. Excellent. There you go. Good. Stay right there. A little more incline. Left shoulder. There it is. Come on up.
It relieves pain. Right here, where you did it.
It
relieves pain. Because it's very hard for me to move my hands and
nice.
my chest and everything.
How's the chest itself? How's it breathing?
It's better. Yeah, a little bit better.
Good.
Than before.
How's the shoulders themselves?
The shoulders. The tension, yes. Less, a lot less.
Good. Have a seat. Let's check that atlas. Yeah. See how that atlas has significantly improved there. All right. Good. We got most of that. Okay, really petite. That was it. Okay. Walk around a bit.
My body feels much less tension and free, more free. Because I was always tense and yeah.
Ready for the last part?
Sure.
Have a seat. Okay, so I saw on the film you have a TMJ. It looks like you have a right AI. Okay, so open the mouth, close, and yes, you do. Pretty big one over here. Okay. Open mouth. Close. No, too fast. Open. Slowly close. Open. Close. Open. Close. There it is. Open. Close. Okay. This needs a little more. Little helping hand. Open mouth. Close. Open. Close. Open. Close. Open. Close. Open. No, do a little more. Open. Close. Open. Close. Open. Close. Open. Close. Open. There you go. Walk around. See how you like that fella?
What does this restrict from?
The TMJ, that's a jaw. Okay? The reason why we're addressing that because the way your spine misaligned, you went significantly like this way.
Yeah.
That's your old childhood problem. It's been there for a very long time. So here's the thing, we can't keep on walking like this. Alright? All twisted up. So how does your body compensate? So it's gonna start twisting. Like this. The problem is it can't just stop midway. You're gonna keep on going this way. And we can't walk this way either. Right? That's why your chest over here, that's where you feel that tension. Start going this way. And then your head going this way here. So yeah, you're being all twisted up.
Yeah.
Just like we see over here, the very tail end of it. So when we start unwinding over here, but over here it's still being twisted up. Okay? So since you're still being twisted up like here, with that ASRA on this right side over here, okay, you still need a little helping hand to unwind a little more. So because it got twisted up so badly on here, like this, that's why the atlas, it went out. Okay. Your TMJ, the jaw itself, also went out because your TMJ atlas is right here. TMJ is right here. It's so close to each other. So therefore, TMJ has a lot of nerve function in there. It can really back into your spinal cord and also to the brainstem itself. So when both of those got knocked out, your TMJ and also your atlas, that's when you experience that dysfunction where everything on both sides, it's just not functioning as well as it should. Everything just feels off, pain, discomfort, straight down to the knees itself. By the way, how is that anyways?
My knees?
Yeah.
They're okay.
Feels fine now, right?
Yeah.
Yeah, so because it's like no different from like having like a major traffic accident on the GW bridge that just shut everything down and made the Cross Park Expressway a parking lot. Okay? If you don't have proper nerve function from the brain straight down to the body and get all that information straight back into your brain, there's that disconnect, there's that dysfunction. That's what we have to just open up all that pathway, get everything start running again, going down and back straight up again. Right? So that's when you start experiencing everything else is like the symptomatic wise, all that the muscle tension, the pains, also that's when you start to feel more. How do you say? Feel more lively?
Now, lively, yeah. Better.
How's your energy?
My energy? We'll see. I think it's better. Like, feel happier. Cause
nice.
I can't do much before. Like, it takes a long time or until I feel better and I have to massage something and it still doesn't cure it. So
all right. Yeah. Well, give us more feedback on the following visit.
Yep.
All right? Okay, we're all set for today.
Thank you, Doctor.
Oh, you're very welcome.
Everything's good. My back is much better. I can walk better. No pain.
Okay.
So it's really good. My neck, it's not so tense anymore. A lot better to move my neck and my arm. And the acid reflux is better. And less pain.
All right. Well, glad to hear. Thank you for the updates.